All right, everyone. Welcome. Happy Friday afternoon. Although these days, sort of Wednesdays turn into Thursdays and turn into Fridays, and suddenly it's the weekend and not much has changed. There's no rush hour traffic. So anyway, I hope everyone is staying healthy. It's a pleasure to discuss um, my work in eyebrows and beards. Everyone is muted. And the reason is because probably we have a little bit too many people for everyone to just talk. However, there's an opportunity to enter questions in the chat section. If you go down, scroll down to the bottom of your screen, you'll see chat. And I will see those messages and I'll be able to answer questions. It's a pleasure once again to present this work. I'm going to do a short lecture. This is a lecture that I actually gave in Cancun, literally like a week before everyone was, everything shut down. And so I flew to Cancun for the day as I was invited to speak on eyebrow and beard transplants. And I'm going to go ahead and present the lecture, making a few alterations. So if there's any questions or any, because this was presented to an expert panel of hair transplant surgeons, but I think that most of you will be able to understand pretty much everything I'm saying. So anyway, this is my work on eyebrow and beard transplants. I have no conflict of interest, no disclosures. There's a growing demand at this point for non-scalp hair restoration. Obviously, thick, full eyebrows and beards these days are in vogue. No longer are the thin, overplucked eyebrows that was very popular in the past. In the past, also, beards were considered for manual laborers and or socialists. And we obviously know that that's not true anymore. It's for everyday working people. It has nothing to do with socioeconomic class. It has to do basically with guys liking the way it makes them look. This is my very first eyebrow transplant. I still remember everything about this patient. I know Roxy's my assistant's on this. Hi, Roxy. She probably remembers this patient too. I did her probably around 15 years ago. And this was an eyebrow transplant. I did around 150 grafts. I didn't know much about how to achieve aesthetic looks in eyebrows as opposed to today. This is what I'm able to achieve pretty reliably in a single procedure. So I've gotten better. I continue to do probably on average 3 of these procedures every week. So what's the importance of eyebrows? Well, they define sexuality. A male eyebrow is flat and heavy. A female eyebrow is arched, more delicate. Second aesthetic role is it frame the eyes. If eyes are the windows to the soul, the eyebrows are their curtains. And they're extremely important in creating a normal appearance. They also portray age, senescent or droopy eyebrows. Older eyebrows droop in medial eyes. There's also a functional purpose, although most of the cases I'm doing for both eyebrows as well as beard is not for functional reasons, it's for aesthetic reasons, but it does protect the eyes from forehead sweat dripping down. Eyebrow transplants were originally performed for reconstructive purposes, but since the early 2000s, and I've been doing these for probably since around 2003, 2004, we've been doing for aesthetic indications, and that's mainly due to the developments in the natural hair transplant results. With all the transplants we do, the older days, eyebrow restoration was done by strips and sticking a strip of scalp from here right into the eyebrows, and those, we still see some of those cases. In fact, I'm doing a revision in a couple of weeks on a young woman that had that done once we opened the girl here in Miami. But typically the much more aesthetic look is created by individual hairs transplanted into hair, and I'll explain that a little bit. It's a very popular procedure, at least in our practice. Approximately 70% of patients are women. That means 30% are men. Patients need to understand the contraindications. Also, surgeons need to understand that. A typical procedure is typically around 300 to 325 grafts, which is around 500 to 550 hairs, but that can range with bigger procedures as well as smaller procedures. The most common reason that patients lose their eyebrows is from overplucking. not necessarily trichotillomania, which is a compulsive plucking, but just from sculpting them over aggressively. Senescence or getting older. As we get older, eyebrows, many patients, their eyebrows thin out. Genetics, trauma, tattoo or micropigmentation, particularly tattoo. Low thyroid levels can cause loss of the outer aspect of the eyebrows. Alopecia areata, totalis and universalis. This is an autoimmune process where this body basically just kills the hair follicles. Syphilis, and finally frontal fibrosing alopecia, which is a progressive scarring alopecia. It starts with the eyebrows. Usually that's the first sign, and then the hair progressively falls out along the hairline. And so we look at the aesthetic eyebrow for men versus women. We obviously see different in the location of the eyebrow. I like to, for men, create a lower border that's all basically flat while creating the appearance of an arch, not by having actually, like in women, the whole eyebrow coming up, but having the upper border just get wider and then drop down. And that's usually more medial than it is for women, although many of my female patients don't have their eyebrows so far laterally. They'll have it more closer to what's called the lateral limbus, or somewhere between the lateral limbus, which is the outer aspect of the pupil, or the lateral canthus, which is the outer aspect of the eye. Somewhere in between there, I think, creates a little bit more of a, I don't know, more natural, more subtle result. But this is basically, the typical ideal shape, but every patient's different. I freehand draw my eyebrows in with every patient. I welcome those of you who I've welcomed or entered into the webcam. Everyone is, the webinar, everyone is muted. At the end or at any time, if you have questions, feel free to use the chat function at the bottom, and you can ask questions right at your minute. I'll answer them. But I divide the eyebrows into three parts. There's the medial aspect, which is the head, the body, which is the majority of the eyebrow, then the lateral aspect, which is the tail. And this is a nice example of a male eyebrow before and after. And you can see it's relatively flat. Once again, every patient's different. This patient wanted somewhat low eyebrows, but he just wanted them more prominent. So for men, the arch is often primarily just along the upper border. Just like I showed you, it comes along the upper border while the lower border is flat. It's and the length is typically around 5.5 to 7 centimeters. And here's another example of an eyebrow, less of an arch, just more flat, but overall filled in. Some patients want this brought in a little bit more. He wanted to stay relatively lateral, and that was how this was done. You can see on both sides the before and after. A female eyebrow with a nice arch, bringing it in more medially, raising it up so it no longer looks so low. So actually all the transplanting I did was along the upper aspect to bring it up. Now, of course, this doesn't replace a brow lift if a patient needs that, but it can be used to further enhance the aesthetic appearance of the eye region. My experience is many women know how they like to design the eyebrows. At least they have an idea, so I give them a pencil at the beginning of the morning to have them draw it in. Most of my male patients trust me more, although many of my female patients as well trust me. And I work back and forth with the patient. I let them see what I've drawn in. I get feedback from them if they have a family member there. And this is usually done on the morning of the procedure. And only reason I use a ruler is just to assure that the peak point of the arch is at the same height, and the length of the eyebrows are the same. Most people do have some facial asymmetry, so you have to show patients where their asymmetry is, so if they can understand why maybe the eyebrows won't be perfectly symmetric. And you can see the before and the after created with a single procedure. Asian eyebrows are always a little more challenging to do. This is one of my nicer eyebrows, one of my favorites of patients. You can see the before and the after, a nice full look. And eyebrows can also be done for patients undergoing gender reassignment. So this patient's transitioning from a male. I did his eyebrows, and when he returned a year later, she was already done most of her transitioning. So the eyebrows were just one component of that. I always explain in the consult that the goal is improvement, not perfection. Around 10 to 15% of patients want to desire a touch-up. Most commonly, that's to get a little more density or make a little adjustment in shape. There's no downside to using makeup or microblading for a really dense look, because there is usually a limit to how dense I can pack these hairs in. If a patient has some scarring, such as from prior tattoos, or maybe they had a prior poorly done transplant to the eyebrows, there is a potential for reduced regrowth. and I will not do it for alopecia areata or frontal fibrosing alopecia. I should say that in the occasional patient who has had alopecia areata, that's been well controlled, I will go ahead and do these procedures and inject steroids at the time of the transplant, and then repeat the steroids every 3 months, 2 to 3 months afterwards for up to 2 years. And I have had some success with those patients. As long as I'm injecting steroids, their eyebrow hair seems to grow. That's only for alopecia areata. Obviously, some patients have had prior tattoos, and if they're really poorly done tattoos, I have to ignore that. The last thing I want is create that high of an arch. This will eventually fade, or the patient can have it laser removed. African American eyebrows are definitely more challenging, but you can see when done properly, we can create a nice improvement. Once again, the goal is an improvement, not necessarily perfection. So when I'm making the aesthetic step, the key thing is when I'm making the recipient sites, which is where the hairs will go into, I like to stay as flat as the skin possible so they grow nice and flat. I use a very tiny blade, 0.5 millimeter in size almost always, and we'll place, as I said, up to 375 grafts per eyebrows. And this is a little, if it's too gory, I apologize, but this is really how it's done. The patient's not feeling anything. You can see how I'm able to make a crosshatch pattern, able to work between the existing hairs. And then the centermost aspect, what we call the head, the hairs primarily grow in a vertical direction, but along the very top row, typically have them grow horizontally. And another example, very challenging case before and after. Another case, this is a very challenging case. Patient had actually hairs that grew up. Rather than disregarding that growth, I actually followed that direction, minimized it to some degree, and that was the result that I was able to achieve. Create a fuller look here and give it more density here. Typically, there are 2 ways to harvest or obtain hairs for transplanting, whether we're doing beards, eyebrows, or scalps. And that's the FUE, or follicular unit excision or extraction, versus FUT, or follicular unit transplantation. FUT is also called a strip procedure, where we take a small strip of skin from the back and suture it closed. Typically, none of my male patients want to have any incision on their scalp. With my female patients, many of them are willing to undergo FUT, a small strip. But once again, that's decided at the time of the procedure. I can do it either way. In general, if given a choice with my female patients, I will do a small strip and supplement that with FUE grafts, but we can do all FUE, and there's some advantages of doing, potentially small advantage of doing some FUT grafts. Most of the grafts we use are 1 and 2 hairs. We do sometimes, though, in patients with finer, lighter hair, we'll use some 3-hair grafts. And I'll harvest the hairs from the area of the scalp which has the best color match, the best texture match, and best curl match. I don't want really curly hairs. I don't want really straight hairs. So I look for an area where there's waves. Now, some patients, we don't have such flexibility, but most commonly that's in the lower back of the head or the mid back of the head. Also the least likely to turn gray when we go hair from the back of the head. Occasionally the color match is not going to be ideal, and I advise patients, listen, your eyebrows are probably going to be a bit darker than they used to be, and/or the frontal scalp, but that doesn't necessarily mean it's not pretty looking. There are many blondes out there with dark eyebrows. So the debate is, you'd use single or multi-hair grafts. My experience, based on over 700 cases, I like to use some 2 or 3-hair grafts. In fact, primarily I use 2-hair grafts. It maximizes the density, and in no way does it need to compromise naturalness. I'll always use single hairs in the innermost aspect and the lateralmost aspect, but I'll use 3 and/or larger 2-hair grafts in the centermost portion. In my hands, this is what gives the nicest and fullest results. However, there are some doctors, there's one other doctor out in Los Angeles that does a lot of eyebrows. We debate, he likes all single hairs. I've done some single hairs, and I'll show you some examples. This was done with all 2 and 3-hair grafts. You see how pretty this looks. This was done with all single hairs. It's definitely a finer look. You just can't create the same density. Does this look more natural than this? I wouldn't say so. So I personally would go with this, but once again, it's up to patients, and I discuss it with them. But most of my patients are going to take my advice and will let me go ahead and do the procedure as I recommend, which is usually going ahead and doing primarily 2-hair grafts. 2-hair grafts, not single hair grafts. And we use these devices called implanters, which can gently place the hairs into the little incisions that I make. This is an atraumatic way for going ahead and harvesting hairs. And this is just a typical example of before and after. implanters we've been using now for all of our hair transplants for the last almost 2 years. Post-op care, patients are typically presentable at 5 days. They have to keep the eyebrows dry for 4 days. There's usually some bruising, which is usually gone within 3 to 4 days. If there's any prolonged pinkness after the procedure, we'll recommend that they take Benadryl and over-the-counter antihistamines, sometimes antibiotics, even sometimes a steroid by mouth. Trimming every 7 to 10 days, more like 10 days is more common. Occasionally, patients need to train some of the hairs, and we have nurses that can advise patients on this. This is an unusual case. This is a woman that came to me that had prior microblading or tattoo, was very unhappy with it, had laser, and this is what she was left with after the laser. She basically wrote to me, she lives in the Southeast, said, what can I do? I advise excising the entire right eyebrow and 2/3 of the left eyebrow. And then after it all healed up, this is what it looked like. When she came back at that point, I did a transplant, and this is what I was able to create for her after it healed up. So the whole process took around 4 months to go from, to do from here to here, actually took around 10 months, because it took around 6 months after I did her transplant, at 4 months after the excision, to go ahead and get this sort of look. But obviously, a huge improvement. This is not for most cases, but occasionally there is the need to excise the eyebrows following the transplant. Finally, when we're doing the procedure, how do we assure symmetry in the desired look? Well, besides at the beginning of the case, marking it out, making sure my patient's happy, I minimize the use of anesthetic. I use a long-acting anesthetic because anesthesia can cause distortions. I have the patient, after I've worked on him or her and I'm happy with it, I have the patient go ahead and take a look at it and make sure that he or she is happy. We usually make a couple of adjustments, and we'll make as many adjustments as needed, sometimes as many as 4, 5, or 6 adjustments until we get just the sort of result that the patient is looking for. But it is really important that those initial markings are ideal to allow me to see, or for allowing me to achieve the result that we decided on at the outcome of the procedure, at the onset of the procedure. I'm going to talk a little bit about eyelashes. This is actually an eyebrow case, but I also did eyelashes. I don't do a lot of eyelash procedures, typically maybe 1 a month. I discourage my patients from undergoing them. This is a nice result that I was able to achieve with around 105 hairs per side. What I tell patients with eyelashes is if they have lost their eyelashes, if they have thinning eyelashes, is to use some type of lash growth product. Latisse, lash growth factor, there's several others. If that doesn't work, then I'm willing to do the procedure as long as the patient understands that, number one, full regrowth usually doesn't occur. So if we place 110 hairs, we usually don't get this full look after one procedure. Secondly, there is a risk of the hairs growing into the actual eye, damaging the cornea. It's never happened to me, but it is a risk. I've had one patient where I had to take 2 of her eyelash hairs out because they were growing in a distorted fashion. She wasn't happy with them. And sometimes, almost always, the hairs need to be trained because they don't always grow exactly in the right direction. This is another example of before and after. These hairs do need to be curled, they need to be trimmed, but the hairs will give a nice look. Finally, there can be tiny little cysts or pimples that can form early on in healing, but that's just the 2 things I wanted to share with you regarding eyelashes. But anyway, it is done originally for a complete absence due to trichotillomania or overplucking or trauma. What we are doing for cosmetic purposes, I only do the upper eyelid. Typical procedure is 90 to 110 hairs. I talked about the realistic expectations and the contraindications. If they have very curly hair like African American, very straight hair like some Asians, I won't do the procedure. It's done under, unlike eyebrow transplants, which are usually done under oral transplant, actually like eyebrow transplants or beard transplants, most of the time these are done under oral sedation. An eyebrow procedure takes around 5 or 6 hours to perform. Eyelashes take around 3 hours. Local anesthesia. Unlike with eyebrows and beards, we want the hairs to be long because they're actually threaded through using a French needle. So to do that, we actually have to make a small strip. That's the way we do this from usually the back of the head. And the grafts can be placed not just between, but also above existing hairs. And as I said, I use a French needle. Dry eye precautions like with eyebrows for the first 5 days, topical oral antibiotics, and the hairs need to be curled daily and trimmed on a regular basis. And finally, I'm going to talk about beards. I also do probably 3 of these every week as well. That's one of our favorite procedures to do. It's a lot of work before and after a single procedure. Most commonly, it's done for genetically thin or patchy eyebrows, or a patient wants a different shape. Some patients have had prior laser hair removal. We do the scarring, like a scar, we can use that to cover it up, or acne scarring, to cover it up. Transgender, patients transitioning from female to male. There's a rare phenomenon called androgen insensitivity, where patients are genetically men, but they don't grow the secondary sex characteristics, including beards. And we don't do alopecia areata, rather. And here's another example of a before and an after. Filled in the mustache, gave a thicker beard, and just overall created just a nicer, fuller look. Can be done in patients of African ethnicity. This is before and after, very low risk of having bumps, but they occasionally do occur. But you can see the before and the after. And another example of a before and after, just filling in not just the cheek beards, but also the mustache and goatee region. And another example before and after. This was actually done on a young psychiatrist, patient of mine, and he told me that he was able to have such better respect, or achieve better respect, because he did mostly child psych, and from not only the parents of his patients, but also even his patients, because he didn't look so young anymore. Also can be done, this patient had a large skin graft placed for some type of cancer removal, and I was able to do transplants. I don't have the long-term outcomes because he was an out-of-town patient. And also patients that are in the process of transitioning while taking testosterone can help with some facial hair growth. This patient wanted a fuller look. And another example of before and after. It doesn't take a lot of hairs to make a nice improvement. With some Asians, we'll go rather conservatively. Also, they're the most difficult to achieve density on. We use almost exclusively single hair grafts to make sure it looks natural. So the way we do these is almost always the grafts are harvested by FUE, which is the 1x1 follicular unit excision or extraction. We trim the excess skin around the grafts. One of the most common reasons I see patients that have had prior beard transplants with which they're unhappy is they have bumps, or it just looks, the hairs are not properly trimmed before they were placed. I generally prefer scalp hair to beard hair as the donor hair, and I'll color match them. So I'll match not just color, but also texture. So the hairs that we're using for the goatee and the center, the center area of the cheeks, we'll use hair from the back because those are the closest match. Meanwhile, these from the side will be more for the sideburns and the posterior portion of the cheek. We use very small recipient sites, no bigger than 0.6 millimeters. Advantage of smaller sites, denser packing, just like with eyebrows, better control of the angulation, less risk of damage if there are existing hairs, less scarring. And once again, we use implanter pens to place the grafts. And here's an example of how I make these grafts. This is how the recipient sites are being made, and this is a graft being placed. And this is an example of, this is a before and after, and you can see how we're placing the hairs using these implanter pens, these tiny little recipient sites, so they're very gently inserted, and we match the curl so they'll complement the natural desired direction. You can see it before and after. Typically, we use only 1 and 2 hair grafts, and most commonly procedures are 1,800 to 2,200 grafts, but that can vary. Sideburns are smaller procedure. This was achieved with around 250, 300 grafts per side. This was a very conservative, just upper, mustache and some portion of the chin. Patient knew what he wanted. I wound up doing a second procedure on it, but all single hairs, just to create a framing, not as thick as we wanted. So we went back and did a second procedure, as opposed to this patient that just wanted as thick a look as possible. This is a patient I did pro bono. He was a vet in the Afghani war. Mine blew up, and he had facial trauma that wound up leaving without beard. So we went ahead and did this for him. Faces of Honor is the program that I work through. We use oral sedation like we do with eyebrows. The anesthesia is actually quite easy. I use nerve blocks, almost like dental type nerve blocks, so that this area stays numb. This area is all done superficially. Once again, I match the donor hairs to the recipient area, and like everything else, like eyebrows and eyelashes, patients need to keep the area dry. What can go wrong? I see these various cases, bumps, poor design. Another case sent to me, just terrible design, just rows, hairs are sticking straight out. It's unfortunate. What we do with these cases, this is due to the use of 3 hair grafts. You can see prolonged redness, poor graft angulation, and the bumps. And this was another case, patient had grafting done, once again, not by me, but there were bumps everywhere. And this is another case of bumps and another case of bumps. This is a guy that came to me that had bumps. We actually had to, and his hairs were growing straight out. We wound up removing around 1,200 of the grafts, and this was his final outcome. So we removed the grafts and then replaced them, replanted them rather. So these were all removed, and all these ones that were sticking out, and we just achieved a more natural look. He came back at this point to have a second procedure just to fill in a more conservative strap type beard, which was going to look natural. So that's what I have. Thank you for allowing me to give this lecture that I gave to a group of doctors just like a month ago. I see we have some questions on chat, and I'm going to start answering them. And please feel free to send more questions by chat. But anyway, the first question is, do you ever do really small transplants in terms of number for eyebrows? For example, if eyebrows seem to end at the end of the eye rather than extend a centimeter beyond, especially if this is in addition to scalp or beard work. Absolutely. In fact, I'll always, what I tell patients is smaller procedures, there's a limit to how small a procedure is. I'll do as small as they want, but we do have in our office, we have a procedure minimum, which accounts for not just the opening up of the OR, but my time, my expertise. So there's always a procedure minimum, but yes, we can go ahead and certainly do just the outer aspect of the eyebrows. Many times what I'll do, if I'm just doing the outer aspect, is I'll do a little bit of transplants throughout the body of the eyebrow as well, just to make sure that there's a little better, even distribution of hairs to give the most aesthetic or natural look. But yes, we can do these at the same time as a hair transplant. It can be done as a standalone procedure. We can do beards and eyebrows. I even can do eyelashes and eyebrows, or even do an upper eyelid surgery with eyebrow transplants. I can't do brow lifts at the same time as an eyebrow transplant. I usually recommend the patient either have it done elsewhere, or I'll do the eyebrow lift first, then come back and do the transplant. But yes, once again, it can be combined with different procedures. Another question. Oh, someone said these webinars are fun. Well, I'm glad to hear that. Is there a benefit to using Latisse or Rogaine on eyebrows? There's no downside to doing it. Please realize that if you do Latisse or Rogaine, that sometimes if you stop the use of these, that the hairs will fall out as well. So you need to be committed to using it. But certainly there's no downside to trying it. Latisse certainly works for eyelashes, but it could work on eyebrows. Also, with just talking about the use of Rogaine, when a patient's young, I will definitely advise them. When I say young, like a male patient is under the age of 25, I will definitely recommend they hold off on getting a beard transplant. Certainly use Rogaine for a month or two to see if they get some further regrowth. But my concern is, and this is another question, is there a risk of running out of donor hairs? Yes, and the reason is because everyone has a finite supply of donor hairs, at least today, given our technology. Eventually, we may have hair cloning, but given today's technology, there's a limit to the total donor supply a person has. So if we're going to go ahead and do 2,000 grafts to a beard, which is fairly common, that will leave the patient, typically a male patient, with only 4,500 more grafts to use for the scalp, which is fine if they're not going to want anything done or just minimum work done. But that's something that always needs to be discussed with patients. When it comes to eyebrows, the impact of doing an eyebrow transplant with a relatively limited amount of hairs is usually, that's not as much of an issue. However, sometimes the patient is young, instead of doing a full 2,000 graft procedure, I'll talk with them and I'll explain, well, why don't we just go ahead and do some cheek beard work, or maybe create a strap beard, or maybe create a stronger goatee. So those are all aesthetic alternatives that can be followed that I'll discuss with patients. Is there a way to do full male eyebrows and ensure there's enough donor hair for hair transplant later? With the eyebrows, as I said, if we're going to go ahead and do, let's say, 300 grafts per side, you're talking about 600 grafts, which is still a percentage of the total amount of scalp hairs, but it's not as much. Typically, it will not significantly preclude me from recommending eyebrows for two reasons. Eyebrows are so aesthetically important for many patients, but also the number of hairs relative to the results we can get, still leaving a lot of hairs left for a transplant, for whether it's a man or woman, is still, I think, sufficient. Is hair growth less on an area with prior laser hair removal than on an area with no prior laser hair removal? That's a great question. Well, first of all, anytime there's scarring, there's always a risk of lower regrowth. This seems to be more of an issue with eyebrows where the black patients overplucked and maybe did tattooing or microblading. If it's a pure out and out scar from like a skin cancer or a laceration, we expect a lower rate of regrowth. In almost all cases where I'm suspicious or concerned about a risk of lower rates of hair regrowth, I will always inject PRP or platelet-rich plasma at the time of the transplant to assure optimal regrowth. When we're doing scars, for example, a patient has acne scarring, I'll usually place in those areas typically more 3 hair grafts, hoping that 2 hairs will grow if we're going to get around 70% regrowth. So those always are things that we need to consider. If there's prior laser hair removal for a beard or an eyebrow, in general, that's not an issue. The facial area has such good blood supply. I haven't found any issues of poor regrowth with prior laser hair removal of the beard. Is it safe to do microneedling of the areas where transplant area? Does it do with ProHelp? I'm not sure the question, but is no problem at all doing microneedling, whether it's done before or after. It doesn't interfere with my ability to do the procedure nor the outcome. Is it possible to do eyelash transplants from leg hair? I do not recommend using any other hair other than scalp hair. There is a doctor on the West Coast, a different one, that uses pubic hairs for eyelashes, but I've seen maybe one or two of his results, in fact, one in person when I was visiting him. However, I've also heard some patients tell me that they did it with that approach and they were unhappy with the regrowth. So I use the consistent result with eyelashes, which is to do scalp hair. Yes, it does require trimming. I don't like using leg hair for any transplants. I would consider doing pubic transplants, using pubic hairs for the eyelashes, as long as the patient understands that there's a slightly increased risk of cyst formation and or poor regrowth. How long after forehead Botox before brow transplant, or does it matter? Probably doesn't make a major difference unless the eyebrows have been adjusted as a result, adjusted in position as a result of the Botox, in which case I recommend that the patient wait for the Botox to wear off. But I've done cases of patients that are on Botox that just get a little bit just to open up the eyebrows. So doing the transplant, the design is not going to be changed if whether or not Botox was in place. With PRP, is the use of stem cells being investigated to help with transplants? At this point, Jim, there's no benefit of stem cells other than maybe for treating primary male and female pattern hair loss. We've done a study investigating this, FDA approved study. Most stem cell transplants that you read about are either done illegally because it's not approved here in the United States, and or they're done, if they're not illegal, they're not really stem cells. They're just doing PRP and saying that they're stem cells because there's a little bit of stem cells in the peripheral blood. So bottom line, stem cells is an area that's a little bit in the future, but it will potentially be available. Next question. If you did a beard transplant on certain areas of the face, then shaved it, will a difference, if any, be noticeable between other parts of the face and the area of the face that has had beard transplants? In nearly every single case I've done, no, there's no scarring. Patients are able to shave completely comfortably. I do get the occasional outlying patient that gets a few little bumps. In those cases, I send them to a dermatologist for laser hair removal. But overall, my patients feel very comfortable shaving, and they feel that there's no problem with. And I take steps as well in the area where they're most at risk for having bumps, which is right here in the soul patch and the chin mound. I use just single hair grafts that are very well trimmed. So that hasn't really been an issue for my patients. Is a PRP a one-time treatment, or are there many? Well, the reason why I was talking about PRP in this case was PRP in conjunction with the transplant. PRP can be used as a standalone therapy for treating male and female pattern hair loss. We use the AMSite system, which is in our hands delivers the highest concentration of platelets, which is what you want. Many systems the doctors have no idea even how much platelets they're getting, which is not the best way to treat a patient. You really want to know what you're giving patients. Plus, we like the AMSite system because it's a closed system, which means that we're not using blood drawing tubes. We're actually using specially designed tubes, so there's no chemicals or anything. Our system, our PRP system with the M site, we do it once and then typically we'll repeat it 3 to 4 months later. Is there a limit to density? I think that is referring to beards, but even eyebrows. Yes, there's a limit to how close I can pack grafts. In the great majority of my patients, I'm able to achieve really good desired results in one procedure. But in those patients that are seeking really thick looks and or that have very light colored skin and dark hairs that are fine, I will advise those patients to expect or to anticipate that possibly a second procedure would be desired by them to get more density. Is there a limit to density? Is trimming skin off grafts necessary? 95% plus of the other surgeons I've come across haven't heard of this before. As someone who's probably done more of these beard procedures than maybe the all 95% combined, because I've done well over 600-700 of these. My experience is it's best to trim the skin off the grafts to reduce the risk of any scar formation. And I don't think you can be too careful. It does add more time to the procedure and more work and more expertise. But in our hands, this is the best way to have it done. So I don't question how I go ahead and I trim the skin off. So assuming that's everyone's questions, a few more questions. Can a patient still do waxing or threading after an eyebrow transplant, or do you risk hair loss? Nope, as long as you are doing the trimming or the waxing or threading after the hairs have fully regrown, and understand that if you keep on doing it, you may lose those hairs again, but threading or waxing is fully permitted. It's not going to make it much, it's not going to harm what you're looking for. Does wearing a hat affect the transplant areas? I assume when we're talking about donor areas for eyebrows and beards, no, nor does it affect it for after a scalp transplant. In fact, we have patients wear a hat as soon as the day they have their procedure, they can walk out with it. Does laser light therapy help transplants grow back faster or better? Laser light is used not just as a preventative treatment for male pattern hair loss. It actually can reverse some miniaturization of male and female pattern hair loss. And finally, it may help transplants to grow back sooner. Generally, the most effective in our experience is the using of Rogaine once a day. But yes, we will go ahead and recommend laser if the patient had a scalp hair transplant. We got another question. Do you use the NeoGraft device for these? I do not use the NeoGraft device. There's a variety of devices used for FUE. NeoGraft is a commercially available system. The great majority of doctors that use NeoGraft are not actually hair transplant specialists. They're usually dermatologists or plastic surgeons that buy a NeoGraft device, hire technicians by the day. These technicians come in, typically they're unlicensed. They come in, do the procedure for the doctor. That's not how we use it. The other problem with NeoGraft and even the Artis, which is the robot or the smart graft, is it's smart punch technology. It's a sharp rotary punch, which has a higher rate of transection. We use the state-of-the-art, which most of my colleagues use as well. There's a couple of drill systems. One is the WAW system, WAW, designed from a colleague of mine in Belgium. One is the Trevolini, designed by another colleague of mine in Argentina. But basically, these are not rotary, but they're actually oscillating, which is a more efficient way for removing grafts, less traumatic. They also use punches that are not sharp, but they're actually fluted. So the flute, the sharper outer edge, does not contact the follicles. The result is we get much less rate of transection. Lower rate of transection of hairs means higher rate of regrowth, less scarring. We can use smaller punches. It's a win-win for both the donor and the recipient area. So the bottom line is NeoGraft is not at the state of the art in my best experience, and I think that just about all of my other top hair restoration colleagues would agree. FUE is a great procedure, but NeoGraft is nothing other than a proprietary device with usually rental technicians. Is around 500 grafts donor from the beard area okay to do? I assume you're talking about harvesting hairs from the beard. We can typically get in one procedure 800 to 900 grafts using for transplant, whether it's to the beard or even the scalp. We actually like these hairs, not as good as scalp, but they are a good source of donor hairs using these beard hairs because they tend to grow very similarly to scalp hairs. Does not leave any scarring, believe it or not. Within 2 days, it's all healed up. And as I said, we can typically get 700 to 800 in one procedure. typically as many as 1,200, 1,300, if not more, from the neck region in 2 procedures to be used for a transplant. Could there be any side effects from doing the eyebrow transplant besides the first few days? I mean, you can have prolonged pinkness that lasts longer than 5 days. Occasionally, it can last as long as a couple of months, but a little bit of makeup can be put on to conceal that. There can be a few pimples where the grafts were placed. As the hairs start to grow out, they develop. That's the exception rather than the rule. Done properly, my patients are almost universally really happy with eyebrow transplant. There's a very low risk of complications. Yeah, Marcia, that may be a bottle of wine, but no, I won't be. I don't plan on getting into it just yet. But thank you very much for your kind words. It was our pleasure to present these meetings. I'm actually thinking about doing a few more on reparative techniques. I think that there's a need for that. I realize that probably 25–30% of my work is doing repairs, patients sort of like a last resort. So I'll be probably doing a few more. I am doing one on Monday with my partner on rhinoplasty, but obviously this is my primary area of passion. But anyway, thank you very much, everyone, for attending. Please feel free, if you have any other questions, to email us directly, or just go to the website, drjeffreyepstein.com. Anyway, everyone have a nice weekend, a safe weekend. It was a pleasure. Take care.